Mental Health America of Indiana is Indiana's oldest advocacy organization. They really advocate for the community versus just a dollar sign.
I think everybody has a personal connection to mental health and addiction. I used to give presentations and I'd ask people to raise their hand if they have a mental health issue or if they have a family member that did or a friend. And by the time I asked all three questions, like literally everybody in the room was raising their hand.
It all starts with people. You can have all the ideals you want in your world, but if you don't have people who have the heart to actually go out and do it, then it means nothing. I've done 11 and a half years of incarceration. That's not how my story begun, and that's not how it's gonna end. And in my life, I've had to feel your challenges, and it seems like right when I'm finna break, with always someone there to lift me up.
We do have a lot of heroes in the field, but they go unnoticed. We like to present awards to people who otherwise are not recognized as they should be. During the event, we ring the mental health bell, Mental Health America's symbol, taking the shackles and chains that once bound people with mental illness and melting them down into the symbol of liberty. And so we ring the bell to make sure that people with mental illness no longer have to suffer the difficulty and the stigma that used to at least go with mental illness.
So this is MHAI's annual Mental Health and Addiction Symposium. What we do is bring behavioral health professionals from all across the state together.
We do it in partnership with the IU Department of Psychiatry. They put together a number of presenters so that our audience can hear the latest research from a national perspective that they wouldn't otherwise be able to hear.
Please join me in extending a warm welcome to Dr. Rodriguez.
All right, good morning, everybody. I am super excited to be here.
I've been coming to this for, I think, 4 or 5 years now, and I think it's so incredibly important because it's a place for us to really gather and really review what our priorities are related to mental health and make sure we're all on the same page.
What is a CCBHC?
What is a CCBHC? A CCBHC is a certified community behavioral health clinic.
It's also a great opportunity to learn about what other folks are doing. We often operate in kind of silos, and so I love coming here and learning about what other centers have been up to, what are some of the great initiatives that are happening in our state. And so, yeah, I just think it's a great space for collaboration, for aligning around priorities for mental health and substance use, and around getting together with the folks who have shared interests.
I'm Asha and I'm from Project Me, which is in Fort Wayne. I love being here at the Mental Health America of Indiana Mental Health Symposium because I love being with all my like-minded people from around the state. And it's so important to gather all the valuable information from all community partners and just valuable people from around our whole entire state.
Our family history of substance use disorders. Another one is peer substance use. So like, are your friends using?
I come every year because I hear different things, and it's so important to network with people I don't see all the time and just to get new information.
Why does he want attention? He's a human. Yeah!
I think it's a good opportunity for us as providers to figure out how to support each other.
As we talk about systems and working together and blending together, from your perspective, what progress do you think we've made in those areas and what more needs to be done?
So much work to do, but yes, we have made a lot of progress.
If we can help even one person, then it's a successful day.
We really look at what are those cutting edge things to really support everybody and make sure that in every community there's someone to support somebody. That's the type of work we're working towards, is just to make a healthier system across Indiana.